Hello everyone, this is Dr. Nitin and welcome to another episode of Health Talk and with another new topic on various health conditions. On this channel, we bring various health and medical experts and they give us guidance and advice on various health conditions and how to live healthy lifestyle. So if you're new to this channel, please subscribe to this channel so that you will get regular updates uh, about various health topics. And if you are not pressed the subscribe button, please press it now and also press the notification bell icon so that you will get immediate notification whenever new videos or new episodes are released on this channel. So in today's talk, we have another medical expert, Dr. Shidram Kamate, who is a nephrologist and a transplant physician. And he's working in Kamate Kidney Care and Vasudha Dialysis Center at Hubli, Karnataka. So he is a consulting nephrologist and dialysis expert with more than 5 years of experience. With his treatment, he has helped thousands of patients in past few years. Dr. Kamate, I welcome you to this episode of Health Talk.
Hello, Dr. Nitin. Yeah, thanks for inviting me as a expert. Yes, we'll start.
Yeah. Doctor, to begin with, can you tell our audience something in brief about you?
Yeah, myself, Dr. Sidram Kamte. I finished my MBBS in SNMC Medical College, Bagalkot in the year 2008, and my MD from Ambedkar Medical College, and did my diplomate of National Board in nephrology in KG Hospital, Coimbatore. And post that, I served there 2 to 3 years, and after that, I returned to my hometown, Hubli and Dharwad. So here I'm practicing since last almost 3 years.
That's
Yeah.
very nice, doctor. This is my one of the favorite questions. Like I ask every doctor. So, Doctor
Okay.
Kamate, why did you choose to become a doctor? Why did you become a doctor?
Yes, yes. This behind that, my role model is my uncle, Dr. P.H. Kerudi, who I grew up seeing him how he used to serve the patients and relentlessly without any tiredness, and he used to work almost 24 hours a day, and he used to heal the patient's sufferings and patients. At the end of the day, he was very contented. So in the childhood only, I saw him as a doctor, and I thought of becoming a doctor and serving the people. So that instigated me in becoming a doctor. Presently he is 82-year-old and he's still serving the needy people in the Bagalkot, Karnataka.
This is really inspiring story, doctor. Many people come to this profession just to earn money and to get benefit out of this. But there are various doctors and various stories where people are devoting their whole life. I see that your
Yes.
uncle is also one of the person who is devoting his life for the care of the patient. And this is
Yes.
today is very amazing day. Today is a National Doctors Day in India. This is very coincidental finding and I'm pleased to have you
Yeah.
on this episode. Doctor,
Yes.
this brings me to the next question. What makes you feel inspired to work in the kidney care?
Pardon, I didn't hear you.
This brings me to this question, like what makes you feel to inspired to work in a kidney care?
Yeah, the kid. When I joined MBBS, only I was fascinated about kidneys. So how they work, their both anatomy and physiology, their pattern of working. Even though they're very small organs, but they're very precious. And I used to see the patients suffering from the kidney disease in my final years and internship days. So then I thought of becoming a nephrologist and serving the needy and underprivileged people who are suffering from the kidney disease.
Okay, okay. Doctor, as I mentioned, today happens to be a National Doctors Day in India. So, can you tell us why do we celebrate National Doctors Day, and what is the role of doctor in the society?
Yeah, Doctors' Day is celebrated because of birth anniversary of Dr. B.C. Roy, who was a great physician and a great family physician, great philanthropist, and he was a great politician and social reformist. He not only served the people, and also served he served as a chief minister of West Bengal for the 14 years, and he built many hospitals. Few are some Chittaranjan Cancer Hospital, tuberculosis hospitals, and he is the only few among the one who has done both FRCS and as well as MRCP. So, and he was also the private physician to our Mahatma Gandhi. He not only did this, and he also served the people. So what he did, and according to what he did was, the government of India gave him highest civilian award, that is Bharat Ratna, in the year of 1961, and he died on the same date when he born, that is 1st July in 1962. So to remember the what he served and what he did to the humanity, we are celebrating Doctors' Day in India as a July 1st.
Thank you, doctor. Thank you for sharing it. So, when I see that people are not much aware about their kidney issues, they don't give much focus on their kidney related symptoms until those symptoms become very painful or they kind of go out of control. So,
Yes.
doctor, can you tell us like how common are these kidney problems? How frequently they occur in patients?
Kidney problem is on the rise now because of diabetic and hypertensive diseases. Kidney patients are increasing in number. So the problem with the kidney disease is the most of people are asymptomatic. The symptoms are not there. They'll go to the hospital with for some other treatment, and they get diagnosed with kidney failure. That is very scary. So in India, the almost it is the top one of the eight common cause of death in mortality in India. So in among the world, it is the top fifth commonest cause of mortality, that is cause of death in the world. So in India, almost 17 to 18% of people are suffering from kidney disease. So out of 100, so almost 17 to 18 are suffering from kidney disease. So it is very huge number. uh, so this is the problem with kidney disease, and the other symptoms of kidney disease are like facial puffiness, lower limb swelling, easy fatigability, nausea, vomiting, and breathlessness, passing of red colored urine, and having bilateral lower limb swelling, reduced urine output, having recurrent renal stones. So all this is can be a symptoms of kidney disease. So is not specific. Kidney disease are not having any specific symptoms. It is having a complexity of symptoms.
Okay. So, as you already mentioned that it's a very common disease and you mentioned some of the common symptoms. So, I guess people should be aware and they should be able to identify this kidney related problems at the initial stage. So,
Yes.
even before the symptoms appear, are there any possibilities that we can identify some people who are most likely to get affected by kidney disease, or can you basically summarize which type of people are at risk for developing any kind of kidney disease?
As I said, the most commonest cause of kidney disease in India as well as in the world is diabetic. So whoever diabetic patients long-standing, that is say 10 years, 15 years, so they are the most commonest to prone to get kidney disease. Next is hypertensive. So patients who are suffering from hypertension, whose recently BP is uncontrolled, so they are the risk of getting kidney disease. Third is who are taking over-the-counter medications, like without any doctor's prescriptions, they go to the pharmacy and take some painkillers or something which is not prescribed. And the fourth is the congenital or hereditary disease, that is which through genes or chromosomes. And next is the risk is more with who are smokers, like cigarette smokers and tobacco chewers. So these all are having a risk of developing kidney disease. And one more thing is patient with having recurrent kidney stones, that is having uh, thrice or 4 times or 5 times a year. So they are very prone to get kidney failure in their life.
Okay. So as Doctor, you were mentioning, so thank you for highlighting these points, because what I see that most of these points are preventable, and
Yeah,
these
yes,
are somehow related to the habits that people carry
yes.
in their lifestyle. So can you highlight some of the biggest mistakes that people make about their kidney related health?
Yes, this is a good question. The biggest mistake is, as I said, if people are having diabetic and hypertension who are not taking proper treatment, or they are not following with the physicians properly, they are missing the drugs, or they are skipping the medications, and they are irregularly they are taking medications. That is the one mistake. And second is not properly hydrated. At least they should take at least 2 to 2.5 liters per day according to the season. Like say it is summer, and you take around 2 to 2.5 to 3 liters. Suppose in winter and rainy season, the amount of intake can be reduced like 1.5 to 2 liters. So uh, preventing hydration, that is dehydration, is the second most mistake they are doing. And as I said, the risk factors in like smokers and tobacco chewers, that is the third commonest mistake who people will do, and they'll end up in kidney failure. And another important is over the counter medications. So without prescription you should not go and take medications for the self, it means you should not self medication. So these are the common mistakes people will do.
Yes, doctor, you are right. So, because of this easy access and availability of over-the-counter medications, people are now skipping visiting or consulting the doctor. They are straight away taking medicines from either local pharmacy or from online websites and stores. So, my request
Yes.
to all the audience is that do not skip the doctor consultation. Do not take any medication without consulting the doctor. It might appear additional step, but the doctor knows best about your health condition. So you should always consult the doctor before taking any kind of
Exactly.
medication. Yeah,
Exactly.
yeah.
Yeah.
So, doctor, so as you mentioned, people are doing some common mistakes. So, can you also guide us, like what could be the possible impact if somebody is ignoring this kind of kidney-related symptoms, or they are continuously following those bad habits? What will happen if a person's kidney do not work properly?
Yeah, initially, as I said, the kidney diseases are asymptomatic. Initially, they'll not come to know any symptoms. So even they continue everything, and one fine day they'll see that their kidneys are totally gone. So the commonest question we get is, "Sir, one kidney is affected or two kidneys?" It is like both kidneys are affected at a time. So kidney failure means both kidneys are affected. It's not a unilateral. It is not a single kidney affected. So the risk factors, what I mentioned, the patients who ignore those symptoms and signs, they'll end up in kidney failure. That is called as chronic kidney disease. The initially kidneys, even though they are two kidneys, um, even though till the last GFR, we mentioned as a term as glomerular filtration rate, till the GFR of 5, kidneys will work properly, means they'll be having good urine output and they'll not be having symptoms. One fine day they'll develop all those problems and they'll end up in dialysis. So if you are not following your doctor's advice, or you are taking over the counter medications and continuation with bad habits and all, you land up in kidney failure and dialysis, and you will end up in dialysis. So dialysis is again, we have to undergo weekly 2 or 3 times of dialysis sessions every weeks till your lifetime. So it is very painful procedure. I'm seeing patients dying during dialysis, uh, post dialysis, after missing dialysis. So all these implications will cause a great loss to the families as well as to the nation.
Right, doctor. So, like in initial period, the damage is kind of reversible, but once it progresses to a stage, it becomes irreversible and ultimately leads to kidney failure. And then patient doesn't have any choice apart from dialysis or maybe even kidney transplant. So,
Yes.
what kind of advice do you have for people or patients who want to get treatment for kidney-related symptoms and they want to live a healthy life? Do you have any suggestion how to keep a kidney healthy in a natural way?
Yeah. If these patients are already diagnosed as CKD, that as I said, chronic kidney disease, uh, there are three options. One is, before starting dialysis, they have to maintain healthy lifestyle. They have to take less protein diet. They have to avoid salty. The salt intake should be around 5 to 6 grams per day, and adequate hydration. If they are having adequate output, they should continue to have adequate daily water intake and avoid all those previous said risk factors. So once they land up in dialysis, the total scenario changes. Again, dialysis, there are two types of dialysis. One is hemodialysis and next is peritoneal dialysis. Hemodialysis, hemo means blood. So the dialysis done through the blood, and either they should go for catheterization or AV fistula. So or AV fistula or AV fistula. So that is a weekly, once in a weekly 2 times or 3 times they should undergo dialysis. So again, during dialysis, the food habit will change. The previous patient who are on not on dialysis, they should take less protein. Patient who are started on dialysis, they should take more protein diet, because during dialysis the protein will be lost from the body. So they have to take adequate protein, and along with that, diabetic and blood pressure control is very important. And they should not skip the dialysis session. Even they skip one session, they'll come in breathing difficulty and they might land up into pulmonary edema and they get intubated and need ventilator support and all. So they should not miss a single session of dialysis, and they should keep consult a nephrologist. So this is about hemodialysis. Coming to peritoneal dialysis, this is dialysis through the abdomen. So they can do dialysis in their home only, daily 3 times. They have to, there's some fluid will be there, around 2 liters bag will be there, that will be inserted, and that fluid will be inserted, and they can go freely walk for 3 to 4 hours, and then they remove the fluid and reconnect again. So daily 3 times they should go. This is about peritoneal dialysis. Hand hygiene should be should maintain during peritoneal dialysis, because infection is the most commonest complication during peritoneal dialysis. So third treatment for kidney patient is renal transplant. So renal transplant is the best treatment available for the kidney disease. Compared to previously, nowadays the number of transplants are increasing in world as well as in India. So that is the good news. And in transplant also there are two types. One is cadaver and one is live transplant. Cadaver is means some accident cases, brain dead people. They are giving, with consent of family, they are giving the kidney to unknown person. That is cadaver transplant. Live transplant means first or second degree relative of your patient who can donate the kidneys is live related transplant. Again, in India, the only 10% of people are getting cadaver transplant. The most of transplant is live transplant only, because awareness is yet to come. So annually, the transplant needed in India is around 220,000 cases to be done annually. The number of transplant required means so much, huge burden is there. But presently around 7,500 to 8,000 only we are doing transplant in India. But considering the accident cases, almost 3.5 lakhs of people are dying in India due to accident. So the awareness is still lagging. So if you match that, and we can come out of the good transplant patient, and they can lead a healthy lifestyle.
Okay. Yes, doctor. Thank you for highlighting this, the huge burden and the lack of proper treatment accessibility, particularly related to kidney transplant, because I think it is very expensive and very critical procedure. So when some people or some patients get this kind of kidney disease, they definitely can visit the kidney expert and the doctors like you. But my question to you is, like, if somebody doesn't, like, we want people not to reach this stage where their kidney is already damaged. So can you guide us how to prevent this kind of kidney damage or this kidney related diseases, how we can avoid it?
First of all, healthy lifestyle. At least moderately, daily they should do exercises. Previously, the goal of walking is the best exercise. Previously, the target was 4 to 5,000 steps per day, but nowadays, according to recent guidelines, at least 10,000 steps a day, the brisk walk you should do to have a healthy lifestyle. Or else you can do cycling, swimming, and other exercises like gym and all. You can keep your body fit. That is the first one. And second is, if you are diabetic and hypertensive, please get controlled. If sugars is not control and blood pressure are not under control, definitely you'll land up in kidney failure. And the third is, as I said, over the counter medications without prescriptions, without any doctor's advice. Don't take painkillers or any other over the counter medications. And if you are obese, maintain good healthy lifestyle and reduce your weight. Obesity also is the commonest cause of kidney failure. It's becoming a commonest cause of kidney failure. So if you are obese, please reduce your weight and have a healthy lifestyle. And as I said about smoking and tobacco chewing, smoking will not only causes cardiac problem, it will also causes kidney related issues and kidney failure also. So these are the few points. And if you have renal stones, recurrent renal stones, and recurrent infections, urinary infections, please consult to a nephrologist and get treated. These are all the preventable causes. If you are not getting treated, and definitely you will end up into kidney failure, and which is very painful to undergo dialysis and so other complications of that.
Thank you, doctor, for giving us such valuable information. So, dear friends, if you are having such kind of health issues, and if you have any family members who are suffering from this kind of condition, please do get doctor consultation. They can give you best advice for improving your health condition. And also, it is very easy to prevent this kind of critical situation. To prevent any kind of kidney diseases, you have to just make few simple changes, few smaller changes in your daily lifestyle, and you can prevent this kind of dangerous diseases and conditions. So our the purpose of this channel is to provide not only just health information or the health guidance, but also to provide the best healthcare services to the people. So, doctor, so can you highlight or guide us what kind of services do you provide in your clinic and dialysis center?
Yeah, in our clinic and we are mainly educating the people. Whenever the patient comes, we first educate. First, we'll see what are the causes, why they have come. So, what are the causes, why his kidneys are failing or almost failed. So, first basic thing is we'll educate the patient as well as the relative. And if it is already patients are damaged kidneys, then we'll start getting treatment. So there are some treatment to postpone the kidney failure, to postpone the dialysis. There are some drugs. So we'll prescribe that. We'll have adequate blood pressure control, and this is called as preventive nephrology. It means patients who has come with kidney failure will postpone the kidney failure so that he should not go into dialysis. Instead of going dialysis to another 6 months, 1 year, we'll postpone to another 2 years, 3 years. Like this is the preventive nephrology we practice. And the second thing what we practice in our clinic and center is intervention nephrology. We do all interventions like dialysis catheterization, tunneled and non-tunnel catheterization, and AV fistula mapping, and renal biopsies, percutaneous renal biopsies, ultrasound guided biopsies, and AV fistula mapping. So and ultrasound by myself to see for any kidney changes or kidney size, shape, and all. These are the interventions we do. And next is dialysis. Coming to dialysis, we are doing both acute as well as chronic dialysis. Acute dialysis in ICU setup. So we have world-class machines at a reasonable price. We are doing ICU dialysis in Hubli, and maintenance dialysis also we are doing at a reasonable prices. And plasmapheresis. We do plasmapheresis also to patients like who are coming with a neurological problem like GB syndrome and myasthenia gravis with myasthenia crisis. And next is the transplant care. We are not yet started the transplant in our unit, but we are taking care of transplant care. So we are adjusting the medications and treating the transplant patients. So in future, we are about to start transplant after applying the license, and so that it will be beneficial to the people of this part of Karnataka.
Okay. So, dear friends, so if you like this video, please do share with your family and friends so that they can also be aware about or they can get the knowledge about preventing kidney diseases and living healthy. And if you have any specific questions related to health and particularly related to any kidney symptoms or any kidney condition, you can ask the questions in the below in comment section. And as I mentioned, the purpose of this channel is to people to get the best healthcare services. So if you are somebody from Hubli or nearby Hubli, and if you are looking for any kind of kidney related guidance or any kidney related treatment, you can visit Dr. Kamate in his clinic and dialysis center in Hubli, and he will be providing you further guidance and consultation after assessing your particular health condition. Yeah. So thank you, doctor. Thank you for your valuable guidance and your sharing your knowledge with us. I hope it will help our audience.
Yes. First of all, we need to change the system and we need to educate the people. That is which is lagging, what I feel. So we need to educate people so that more and more kidneys are saved and they lead a better life rather going into dialysis and transplant. So that what is our motto mainly in preventive nephrology.
Thank you, doctor. Thank you for sharing this. This is really inspiring. And one more request to the audience: if you haven't subscribed to the channel, please do subscribe this channel and share with your friends and family. That's all for today, friends. We will come back again with another medical expert in next episode of Health Talk. Thank you.